When you go to a chiropractor's office for the first time, or really any musculoskeletal expert, including physical therapists for that matter, there's some basic things that you should have performed to make sure that you're receiving the best care possible. And I'm going to go through some of those in the next series of videos. We often refer to these as the standards of care. So this first video, we're going to focus on the neurological examination. I'm Dr. Alex Tauberg. I'm a primary spine practitioner and certified sports chiropractor. I enjoy helping people get out of pain and back to their favorite activities. So the neurological exam is one of the most important parts of a musculoskeletal examination. This is especially true when the patient is presenting, or if you are presenting for neck pain, headaches, or low back pain. So it can tell us a lot of information. This information can range from something that's basic, such as letting us know more specifically what needs to be worked on, all the way up to very important information, such as letting us know when a patient needs to be sent to the hospital as they are undergoing an emergent situation which needs emergent care. So without the neurological examination, when a practitioner fails to perform it on you, they might be missing vital information that they need in order to treat you. So at its most basic level, a neurological exam should include three parts. These are the deep tendon reflexes part of the exam, muscle strength testing, and then sensory nerve testing. So you're probably familiar with deep tendon reflexes, probably had it performed at your primary care doctor's office. Very basic, often performed with a reflex hammer like this, but there are other types of reflex hammers. So what is done is you take one of these and the doctor should know where to hit it, usually the knee or the elbow, and they're looking at the reflex arc, and they're often comparing the reflex arc on one side to the other, making sure that you're equal, making sure that they're not seeing anything that's abnormal. So that's a very vital, important part of the test that can let us know when things are really going wrong. Next, we have muscle strength testing. So muscle strength testing is exactly what it sounds like. During this, the practitioner has the patient hold a specific position. For instance, I'll often have patients hold this position, and I will then tell them to resist my movement, and I press down on their arm, and this tells us that the muscles in this area are working properly, often telling us if they are being innervated properly, or if the nerves are irritated or not working correctly in that area. It can also give us some other information that is not related to the neurological exam, but I'm not going to go into that today. Finally, we have sensory testing. This is often done with a pinwheel. So a pinwheel is like this. It could be performed with this. It could also be performed with other things. Some people perform it with cotton balls. But essentially what the practitioner is doing is they are testing the sensations on one side of the body compared to the other, making sure that they're somewhat equal in nature, making sure that when they test the sensation on one side, it's not dull when compared to the other, or it's not overly sensitive compared to the other. So what this often looks like is just rolling the object on one side and then the other, and then asking the patient, does this feel similar to this? So while these parts of the examination are relatively basic and you might not think that they're overly important, they actually are critical, in my opinion. Any qualified practitioner should be doing them, and I believe that any qualified practitioner would tell you that they should be doing them, especially, like I said, for patients that are suffering from neck pain, headaches, and low back pain. There are certainly more parts to the neurological exam, and you can get more in depth with the neurological exam, but this is kind of the basic level. So I hope that you have found this useful, and you can use this information to help you find someone who is going to treat you appropriately and with the best care possible.